Are you or someone you care about experiencing extreme behavior or major mood swings? Today in this video, we will explain the possible causes of bipolar and the differences in symptoms between bipolar I and II and their treatment options. This video is an overview of bipolar disorder. If you're concerned or think you may have bipolar, please see your doctor, as only your doctor can give you the proper diagnosis. And please subscribe and hit the bell icon so you won't miss out on our weekly videos. Let's begin. What is bipolar disorder? It is a mental condition or an illness in which a person shows extreme shifts in their mood, their behaviors, changes in their thought process, and sleeping habits. A person with bipolar may experience episodes of mania, where they are exhilarated and energized, while other times they are feeling low with depression, exhibiting sluggish or sad or hopeless behavior. A person with bipolar may experience higher highs, alternating with much lower lows. These shifts in moods don't happen all at once. They usually develop over a few weeks and typically last for an extended period of time. What are the symptoms of bipolar disorder? These symptoms vary from person to person, as there is no definite pattern of what an individual with bipolar may be feeling. There is a variation in the symptoms, ranging from hypomania, mania, and depressive episodes. Both mania and hypomania may have different episodes, but they do have similar symptoms. However, hypomania is less severe than mania. The following are symptoms of mania and hypomania. They are overly excited, joyful, and extremely happy. Also irrational and often making impulsive decisions. They can become restless and unable to sleep. Experiencing euphoria or an exaggerated sense of self-confidence. They can experience sharp changes in mood from being happy to irritable. Their thoughts can come fast and random, and their speech is rapid. They just can't seem to focus on anything, and their concentration is poor. And what many people don't realize is that 50% of manic people also experience grandiose delusions and hallucinations. Grandiose delusions are false beliefs that a person perceives to be true. For an example, they may believe that they are famous or have been chosen by God to save the world. Hallucinations are sensations that an individual perceives as being real. Sometimes they see things that aren't actually there. They can experience auditory hallucinations, where they hear voices from people that don't exist, but they believe they do. They can also experience body sensations, like the feeling of bugs crawling on their skin. Whereas hypomania is a milder state of mania and does not include hallucinations or delusions. Hypomania is described as a mood or energy level that is elevated above normal, combined with behavior changes. Bipolar people also suffer from depression. The following are typical depressive symptoms that are experienced during their depressive episodes. Feelings of sadness, emptiness, and hopelessness. Decrease in energy and feeling very fatigued. Sleeping too little or too much. A loss in interest in something they once enjoyed. Difficulties with concentration and indecisiveness. Feelings of worthlessness or experiencing inappropriate guilt. There are three main types of bipolar disorder. The first one is referred to as bipolar I, and here are their symptoms. The classic form of bipolar I disorder involves manic episodes, which includes the rapid speech. They have grandiose beliefs or delusions, or they can become irritated very easily to experiencing moments of euphoria and an increase in sexual desire, switching to periods of immense depression. Bipolar I individuals have major lows for at least 2 weeks or more, to a higher high for over several days. Some manic episodes, if left untreated, can last up to 6 months. Depression is a common symptom in both bipolar I and II. The next classification is bipolar II. These symptoms include people with bipolar II have severe depressive episodes in which they feel sad or hopeless. That is alternated with hypomanic episodes, which is a pleasurable state. If symptoms of mania occur, then the diagnosis changes to bipolar I. The third main classification of bipolar is psychothymania. The psychothymic disorder is relatively mild compared to bipolar I and II. Mood swings between shorter periods of light depression and hypomania. that never reach the severity of severe depression or full mania. A person shows episodes of both hypomania and depression. However, its symptoms are not as intense as the case of bipolar I and II. What are the possible causes of the bipolar disorder? As we already mentioned earlier, bipolar disorder is a mental illness, but doctors are still not able to find its exact cause. Doctors believe that there is not one single factor that causes this disease, but is more of a combination of different factors. These possible factors are genetics. Several studies suggest that if your parents or siblings have a history of bipolar disorder, then there's a higher risk that you may develop a mental illness as well. But this is not a guarantee that it will happen. Biological differences. Another reason or cause behind developing a bipolar disorder is a difference in their biological factors. The structure of their brain may be the cause of this mental illness. Any abnormality in the structure and function of the brain can put them at risk. Hormonal balances. It is possible that the imbalance of their hormones may trigger bipolar disorder. Environmental factors. Sometimes it's not related to our body or physiology, but the environment and the surroundings that also play a triggering role. Environmental factors include extreme stress, traumatic experiences, drugs and alcohol use. It can also develop from a physical illness. So what are the treatment options for bipolar disorder? There are different kinds of treatments, and the following treatments may help manage episodes of mania, hypomania, and depression, so they can help live a normal life. The primary purpose of this treatment is to reduce the episodes and decrease the frequency of such extreme behavior. The first and immediate treatment given to bipolar patients is in the form of medications, as prescribed by their doctor. This medication usually takes several weeks before it starts to work. And never stop taking this medication abruptly, as you can experience a rebound in which your bipolar symptoms may come back even more severe than they were in the beginning. The doctor may also prescribe an antidepressant to help combat the depressive component of the bipolar disorder. Antipsychotic medications are also commonly prescribed as needed. These medications will help during their manic episodes. Anti-anxiety medications are often prescribed too. This will help them deal with their acute anxiety and stressors. Other effective treatments involve various psychotherapies. The three most common treatments are: number 1, cognitive behavioral therapy. It's more like talk therapy, in which the individual can discuss with their doctor many beneficial ways to manage their bipolar disorder more effectively. These suggestions may also help them understand their own thought process, and this will help them by providing them with more tools to cope with this disorder. Number 2, psychoeducation. This is basically a form of counseling where the doctor gives them and their family detailed information regarding the bipolar disorder. This type of therapy has been shown to improve patients' overall knowledge and their disease and understanding the importance of being compliant with their treatment, thus increasing the likelihood they will stay on their medications to prevent further relapses. Number 3, interpersonal and social rhythm therapy. This therapy mainly focuses on maintaining healthy daily habits, like exercising, eating healthy, and creating appropriate sleeping schedules. A staying on schedule has been proven to be effective to help individuals with bipolar disorder. With proper treatment, you can manage your behavior and live a healthy, fulfilling life. Thank you for watching, and please share with someone you care about.